Hi everybody, it's Duncan at Survivors Manchester. I just wanted to give all of those that use our service a quick update straight from the horse's mouth about the status of all of our services here in the organisation in relation to the coronavirus pandemic. My operations director Chris and myself have been in meetings all day, and we think we've worked out the best plan of action to ensure that we can reduce the possible contact of the virus to all of our staff and to all of those of you that use our services, to ensure that we can keep the organisation open as long as possible. So as of next week, we're going to move to a slightly altered way of working, which means that there won't be as many people in the building at any one time. Now, this is in line with some of the advice and recommendations that the government and the NHS and public health are issuing in terms of contact with other people. Now, this is really important to know. We're certainly not closing, and we're certainly not reducing the support that's available. Although, unfortunately, we are going to have to suspend a couple of our community-based activities just for the time being. But let me be clear, the safe room is still open, and it will remain open for as long as we have the venue and as long as we can facilitate that space. The one-to-one therapy and is for service, that will run as normal, although there might be a slight alteration to some of the timings. We're trying to make sure that staff can come in and go out of the office at less of the rush hour traffic. We're also going to be ringing people every morning who have appointments that day, just to ensure that they know that their appointment's still open and to check on their health and well-being. If people feel that they don't want to attend their appointment because they're worried, then that's perfectly okay. We can cancel that appointment and we will remake it. I don't want anyone to worry that if they don't turn up, then their file will be closed or they will be kicked out of the organisation, because that's not going to happen. We're asking people to wash their hands when they come into the building. And today we've installed a hand sanitizer on the door, so it just gives us that extra protection, just making sure that we can reduce the possible contact of the coronavirus on surfaces and door handles, things like that. We're also going to be stepping up more our cleaning regime. And finally, we're going to ask people to just contact us, just be a little bit more aware that if you are feeling unwell, that it's best for you not to attend your appointment, but just let us know and we'll rebook that appointment for when it is safer for you to be here. Follow NHS advice. Don't necessarily follow what someone on Twitter or social media platforms are saying. Look to the experts for the advice. And when people are self-isolating, reach out. Don't be on your own. Voice mails and text messages and email and even a telephone call. If you do have to self-isolate, then give us a call or let us know and we'll call you. We will get through this together, and we want to make sure that we reduce as much panic as possible. So look after yourselves and each other, and we'll try our hardest to make sure that we look after this place, because we know it's essential for you. Thanks a million.